Good afternoon. I'm Jeff Flaks, the President and Chief Executive Officer of Hartford HealthCare. Thank you for joining us today. Let me first just begin my comments. Our thoughts are with everyone, all of our communities, everyone who's been impacted by this really devastating storm within our region and across our state. And I just want to be clear, here within Hartford HealthCare, we will do everything we possibly can to help people, however appropriate and however we're able to, throughout now this new crisis. When we see what's occurring within our communities today, it was so clear to me, again, to see the resiliency of people who work in healthcare, to see the heroism of people who work within healthcare. This morning, everyone woke up to such difficult circumstances, and we woke up to having 1,562 people in our hospital beds. We woke up to having nearly 600 plus people we were caring for in their homes through home care. And we woke up to hundreds of surgeries and procedures that we were planning to do today, and thousands of visits in our medical offices. And people who work in healthcare, they're heroes. And today was just but another wonderful example of the resiliency, of the courage, of the strength, and the conviction around the work we do. When tens of thousands of people who work within our system and across healthcare across the entire state of Connecticut came forward, figured out a way to get to where they needed to be so that they could care for others and they could provide these indispensable and essential services to our community. I want to underscore that today our phone number, 860-972-8100, it continues to be up and continues to be running. Throughout the COVID-19 crisis, we've had nearly 135,000 people call this number, ask for help where they needed tests, where they needed telehealth consultations, appointments to see their different physicians, advice and counsel around emergent versus urgent care. We have practitioners waiting by the phone, ready to help people. So however we can be helpful, I want to underscore in this moment of crisis, this tropical storm is, I believe, the third largest storm in at least our modern history in terms of the devastation that it's caused. Nearly, I think it's 48% of the people in the state of Connecticut are without power. So please, if people are in need, if we can help them, call this number and we will do whatever we can. Part of what was important in this crisis for COVID-19 was we recognized the really disproportionate number of people who needed help around behavioral health. And with the crisis of COVID-19 and now a new situation that we're responding to and dealing with within our community with this tropical storm recovery, for people who are in need of behavioral health, we have standing by 24 hours a day, 7 days a week, people who will field phone calls for you, speak with people who are in need, and help them get to the right level of care they need at the right time. So what I really want to urge people to do, however we can be helpful, to recognize that we're here for you, we stand with you, and we are prepared to do whatever we're capable of to support all people within our community at this time. What I'd like to do is ask the president of our Behavioral Health Network, Pat Riemer, to come forward, and for Pat to speak more specifically about our efforts around behavioral health and what we're doing to make more access to these services for our community during this time when it's most acute and most in need. We want to be here for you, and Pat will explain what we're doing and certainly field any questions to help people access really this essential care and service at this very difficult time. Pat, please.
Thank you, Jeff. Good afternoon. So more specifically to talk about our Community Care Center line, where is actually being referred to as a hotline as well, the number that Jeff Flaks just mentioned. We've gotten over 1,000 calls for behavioral health services. And as Jeff said, we are answering those phone calls with clinicians trained in behavioral health. Some of those individuals are calling just to check in with people and perhaps ask a question. And some people are actually calling because they think that they need services, and we are setting those evaluations up. If you think about over 1,000 calls, but 3 million people in the state of Connecticut and 1 in 4 individuals struggling with a behavioral health issue. While we are thrilled that we've gotten those calls, we do think that there are more out there. Again, we remember that the World Health Organization predicted an increase in suicides over the next year by 75,000. And we are beginning to see some of that actually take place in Connecticut. So it really is critical if people do have behavioral health needs, if they've relapsed, if they're struggling with a long-term illness that has suddenly become symptomatic, this is the number for them to call so that we can help them get back on their feet. So at this time, I'd like to introduce Lori Johnson, who actually is the manager of the call line, among other responsibilities. So she can talk with you a little bit about some of what we're hearing when people call in.
Thank you, Pat. And good afternoon. So since the call line opened, the emotional support line opened in May, we've had numerous calls from Connecticut as well as other states throughout the country, people looking for people that have had emotional problems, that have been revived by a lot of the COVID activities, people that have never had problems before, but due to all the prolonged isolation, they've developed some anxiety and depression and have called to get some support, get some guidance, get some assistance helping them manage their anxiety. And so we strongly encourage people to call. If you've not experienced this kind of stress before, by all means, don't hesitate to call. We're happy to talk to you. And if you need further services, we can even set them up. We've set up services for over 100 people since May for ongoing treatment that have requested that. So now the storm has certainly added another layer of stress for people. And we certainly understand and empathize with that. So we're more than happy to take your call. Thank you.
Just as we conclude today's press conference, I also will open it up to questions, but I want to be very clear. We're still working through the challenges of COVID-19 within our communities. And we're very proud of the efforts that are occurring across the state of Connecticut, but vigilance is essential. So we want to underscore again the importance of proper social distancing, wearing a mask, hand hygiene, and really paying close attention to the travel advisories. This vigilance is what has really propelled our state to continue to do very well, and it becomes essential as we look to contain this virus as we go forward. If I can, with Pat and Lori, we'd be happy to answer any questions that you may have.
Yes, I have a question.
Please.
This is Mike Hammond with the Hartford Current. Thank you so much for doing this press conference today. Just with the sheer overload of problems hitting Connecticut residents, some of which you've talked about, widespread unemployment, financial insecurity, and so on, and now to have to deal with, this going without power just seems just absolutely over the top. Can you talk a little bit about the emotional toll that this can take on just even the strongest of individuals?
Absolutely. Let me ask Pat Riemer to speak specifically to that question.
So I think, this last sort of disaster over the last 24 hours has absolutely, I think, pushed some people to their limits. And so we're, really encouraging people to think about the coping skills that have worked in the past. If you're somebody that's been a runner and you can get out and run safely, if you're somebody that has taken yoga classes, there are certainly yoga classes online that people can do. It's really critical to try and find positive coping mechanisms as opposed to some negative ones that could come back fairly quickly. One of the things we're concerned about and seeing a bit of is individuals with substance use issues relapsing even after years and years of sobriety. So it's really, as Jeff said, very important that people remain vigilant about what they're experiencing and what they're feeling so that they can reach out for help if they do need it.
Terrific, thank you.
Hi, my name is Daniela Donzel. I'm on the WTIC radio. I have a quick question, and I do appreciate everything that you are all doing to provide us with this information. I'm wondering how you're possibly trying to get in touch with communities of minorities, people of color, where sometimes in cultural ideologies, seeking out for help is a bit of a taboo, and maybe some people do not see either the point or do not think it's a strong move for them to actually reach out for help. And as has been mentioned, this last power outage, everything, probably taking a toll on some people and are not considering reaching out for help. So what can people like that do in that circumstance?
Well, you're absolutely right. We definitely see racial disparities in behavioral health. And certain cultures do struggle with asking for help because of the, and I don't call it stigma, the discrimination that people with behavioral health disorders often experience. Again, this is a time when if you are a neighbor, a family member, a friend of somebody of color or Latino, it's really critical to encourage people to not be ashamed to reach out. Because again, if you think about the people that may be living in inner cities with the heat that's going on and now no power and their kids are out of school, I mean, the stress is enormous. And so to anticipate or to expect yourself to be able to just manage that alone is really probably not a good idea at this point.
Thank you.
Any other questions for us?
Thank you very much for joining us today. And again, we urge people, if they are in need, dial 860-972-8100, and there are people standing by 24 hours a day, 7 days a week to help you. Thank you so much.